When I think about plastic surgery, everything really is in the details. Every single thing you do to a patient in surgery will in some way influence their result and what they're going to look like and the success of the surgery. So when I'm operating on somebody, every little thing that I'm doing, I think about, and I make sure that this is going to give them the best result and be in the patient's best interest. Similarly, everything I've learned through experience and all the learning that I've done and all the procedures I've done have built up a list of things, of thousands of things that I can do in surgery that I feel and I know based on my experience will give a patient the best results. And every procedure I approach from start to finish with all these little details in mind so that I can really think and always try to do better for my patients with all these little details that I have in my head about how to start the surgery, how to suture a wound, how to place breast implants, how to create an ideal belly button. And that's the really fun thing about what I do. I really feel that things are always changing, things are always getting better. I feel that I myself can always do better, and I will strive to do better through these little details that we implement in surgery, and in particular plastic surgery, to get always to the best result for our patients. It's really these little details that separate an average result from a good result to an excellent result. And I feel that sometimes I see plastic surgery that didn't turn out ideally, and what I see is that the procedure was done in a fairly standard way without any real refinements. And I think that's really the difference that I see between great results and just average results, just the implementation of all these details that can be learned or taught or acquired through experience of the surgeon. I'll give you an example. Everybody talks about having a scar that isn't visible. And a very easy way a surgeon could close an incision, which is a cut on the body that a surgeon uses to do surgery to cut through the skin to access the inside of the body. You can take a surgical stapler, and there's nothing wrong with surgical staples. I use them for some areas, but that wound can be closed in 10 seconds. It literally would take 10 seconds with a stapler, and you would just staple the wound shut, and then you would get some form of scar. And my belief is that when you do something like that, you're not going to get the best result possible. So instead, what you could do instead is, in surgery, what we do is we create layers of sutures, deeper sutures that bring a wound together and support the wound from the inside. When it's healing, it doesn't split apart, it doesn't stretch out. And we believe that when you relieve tension on skin that's brought together like that, you have the best scar. And that's what we do in plastic surgery when we suture cuts on the body together after we've cut the skin. And often in those cases, we get a very minimal, almost invisible scar if the surgery's been planned properly. Symmetry is another detail that we pay extreme attention to in plastic surgery. Nobody's bodies are completely symmetrical. Left and right side is always different in the case of the face, the breast, the body. If you look, there are natural differences between the two sides, even in something that at first glance looks symmetrical. This is something that people really focus on after surgery, so it's really important as a plastic surgeon to give patients as symmetrical a result as possible. And this is a detail that has to be understood. You need to have an eye for it, especially when you're operating on somebody's face, for example. Millimeters matter, and you really have to have a good eye for symmetry and that kind of detail to give patients the very best result.